Good evening and welcome. This is Tim Ashe, President of the Vermont State Senate. It is Tuesday, May 5th. This is my nightly update on Vermont's response to the COVID-19 crisis. We are now entering into, I think, the 8th week of this new sort of phase of the narrative arc of COVID-19. What is encouraging are some of the public health measures that we've been following over the last 2 months. The number of people who are hospitalized with acute symptoms of COVID-19 is about 1/5 of what it had been hovering at about 4 weeks ago, all of which is positive. Now that we're testing far more people, we're starting to see a few more people test positive, which in some ways is natural. Just because the volume of testing goes up, there's going to be some additional positive tests. Before I turn to our two guests tonight, I want to just briefly say I was on a call with a number of Vermont restaurant owners from around the state earlier today and found, it was really heartbreaking having those discussions because, of course, many of the employees of restaurants are the ones who've been able to get through to the Department of Labor are collecting unemployment benefits to which they're entitled and receiving a federal boost each week of $600. However, the owners of the restaurants, many of whom took great risks to start their businesses and operate very low margins, none of the federal programs have to date really been of much use to them. So listening to stories of restaurant owners around the state, very, very difficult to hear. They all want to get up and running as soon as it's safe to, but we know it's not yet safe to, and they know that. And it's not clear to them when they'll be able to open and under what circumstances. So I hope people will be thinking about that in the coming months, because even though some restaurants are trying to make a go of it with curbside service or window service, that is not the case for the vast majority of restaurant owners who really work really hard and in many cases never make too much money from the restaurants they own. So I hope we'll be mindful of their plight in the days ahead and be thinking about how we can support the industry as the economy makes a comeback. But tonight I'm really grateful to have two guests join me. Kris Lukens, who runs Voices Against Violence, and Amanda Cochrane, who is the director at Umbrella in the Northeast Kingdom. Both organizations serve individuals who are suffering or impacted by domestic violence and sexual assault or at risk. And I want to thank you both for being here tonight.
Thank you. It's good to be here.
So I think, I'm particularly interested in the question of how COVID-19 and people being under the stay-at-home order from the governor has impacted your work and the clients that you serve, what it has done to either put pressure on the existing challenges they face at home or with people who might be victimizing them. But before we do that, I think it might be helpful maybe if you each take a quick second to describe the normal pre-COVID activities that you provide for this very vulnerable group of Vermonters so that we can then put it in the context of how things have changed if they have under COVID-19. So maybe Kris, do you want to take that one first?
Sure, I'll be glad to. I think, most of the folks that we work with contact us through our 24/7 hotline. So we would get hotline calls. We staff the office during the day, and we also have a shelter that can house up to 8 women and children, or 8 survivors and their children at any given time. Our shelter was always full before COVID. Now not so much. But also, I think, some of our normal activities were, obviously answering the hotline, dealing with issues, people wanting, restraining orders, or people interested in help with some legal issues that they may be experiencing, calls about, safety issues or needing shelter. We also had, our educator was in the schools a lot, doing trainings and presentations with school-age children or out in the community. We also had partnerships with probation and parole, for instance. So we had a person co-located over there and would work with victims that would be coming in, talking to probation officers and that sort of thing. So those are some of the ongoing activities that, were a part of our day-to-day
And
work.
your service area is largely the St. Albans area and surrounding towns?
Yes, we're in Franklin and Grand Isle County, so we serve both of those counties.
Okay, great. Amanda, how about in your neck of the woods?
Very similar to what Kris had to share in terms of direct services to clients. I guess I would add, I'm sure this is true in St. Albans too, but also we'd be working with walk-ins who were just coming in during the day, knowing we were there to see them. Something might have happened the night prior and they might be coming in just as they might call the hotline to talk about, their options and get support. We do a fair amount related to housing as well, including our shelter spaces in Newport and in St. Johnsbury, and also support people with permanent housing. So helping them get on to transitional housing and then to permanent housing as well. So we spend a lot of time working with folks on that generally. But just to echo all the things Kris said, I'd say, also hospital advocacy. So
Right.
if somebody was sexually assaulted or assaulted physically by a partner, we would support them in the hospital through a rape kit if they were sexually assaulted and wanted to do that in order to report that crime.
Well, I think, the work that you and your peers around the state do, it's probably very much, I know it's very much appreciated. You would not find someone who says that they don't totally value the work that you and your staff do, although frequently it's out of sight, out of mind for many people. So that's easy to take for granted that someone's out there helping people in crisis. And I don't think everybody has a deep appreciation for what it's like to have to do that work. So under normal circumstances, you're dealing with crisis situations all the time. And I know that, very many people greatly appreciate it, even if we take it for granted at times.
And Tim, if I might too, we also just, supporting the children who are impacted by domestic and sexual violence. Many of the member programs and including Umbrella, work with the children that are involved in those cases as well. So that's something that we do kind of as a matter of course.
Well, which is totally critical because of the impacts it's going to have on a kid's the rest of their life if that's what they're being exposed to, and make sure that there's some kind of rehabilitative or therapeutic approach to rebuilding trust and all the other things that are so critical. So as COVID-19 was starting to come over to the US and we started seeing it in other states, we were obviously thinking about it at first in terms of just straight public health. How would it affect people in terms of becoming infected, hospitals? I think we then started to realize that the impacts were going to be much broader, both economically, but also in our personal and social lives. So from your point of view, you're describing, walk-ins, you've got, calls coming to crisis hotlines, you've got work in the courts and in community settings. At what point did things start to shift or look and feel differently from the work you're doing? And maybe Amanda, you start this one.
Yeah, it's interesting, right when that kind of all happened, where we were, ordered and even before that people should really telework if they could. We didn't see a large uptick, immediately for sure. Things were kind of quieter, I'd say. And then, within a day, we kind of we were able to share what we were doing in response and how people could contact us, primarily through our hotline. Now, and with people teleworking from home, being able to support them. But I'd say that what we're seeing has been a real consistency with the amount of calls we're getting pre-COVID and now current, kind of COVID crisis experience. What we are seeing though, Tim, is more violence than we had seen before. So while we think of it all domestic and sexual violence is harmful, and there's certainly, power and control that individuals, exhibit towards their partners that is, of course, so detrimental. But we're seeing more of the physical violence now than we had pre-COVID. We're seeing a lot of that. And we think that that's a real result of the extreme stress and the extreme circumstances that people are finding themselves in, kind of stuck in place with folks, with
Kris,
partners.
same thing up in your neck of the woods, or different experience?
No, I think very similar. Definitely we're seeing an uptick and I think the complexity of the situations of people calling in, that they're stuck at home and they're very, ways to reach out have really been reduced. But right before we started working remotely, we actually saw our hotlines were a bit quieter. And it was a little unnerving because we know that doesn't mean that there's no domestic or sexual violence going on. But worried that folks weren't able to reach out to us. And then once we started working remotely and really publicized that we were still available and let our partners know and let the community know, then we did see an increase in hotline calls.
Well, you guys,
again, just like Amanda said,
you guys are in the profession, so you're used to, these kinds of, when a trend doesn't look right or
right,
something doesn't look and feel right. But for people who aren't, immersed in this work, when you stop getting phone calls, what is it that you worry? Why do you worry about a reduction? I mean, think about it. Like if most people were saying, oh, fewer calls to a crisis hotline, they would say on the surface, a very good thing. But why would that be a concerning thing, Kris, for people who do your work?
Well, because we know that violence didn't stop. We know that something else is preventing people from calling. And it's whether they're not able to call or something else is going on in their lives. We wonder, we start talking about it as staff, we talk about it, and it's very concerning. But it did definitely shift. And then people were starting to call again. And because people couldn't walk in also, when we started the stay at home and shelter in place, as Amanda mentioned, we have walk-ins and people, show up at the office, but that wasn't happening, obviously. People weren't free to do that. So we knew that there was just a little bit of a lull, I think, so that we could figure out how we were going to reach out to people and how they were able to reach out to us.
Amanda, when people start to realize they can still reach out for services and that the call volume has gone down for a little bit, when the phones start ringing again, or when they started to rise back up, are people acknowledging that the reason why they might have taken longer to call was that it was not as safe because of, the presence of a, dangerous partner?
Yeah, no, we're definitely hearing from clients that they can only call certain times when their partner maybe goes to the store or leaves, if they're an essential employee, or, they might have not have access to a phone, so they might have had to borrow one or have to wait to get a computer. Yeah, so it's this whole arranging that they do generally to be able to come to get our services. They're going to say they have a medical appointment. Often we'll go and meet people at that medical appointment so that they, can use that kind of as their out, and we'll go and meet them there and provide our services where they can't do that now. There's not as many opportunities for them to go out. So they're kind of finding that way, that time frame within their new kind of COVID life to be able to reach out for support, I think. And the other thing that we're not hearing from, and I know, that's concerning as you talk about when you're not hearing from things from people, is related to child abuse and child sexual abuse. There's a pretty big concern that, there's not all eyes on kids like when they're at school. And so, concern remains related to what's going on at home for younger kids or teenagers even who are at home with an abusive parent.
Is there any evidence at this point to suggest that that greater risk that kids may be in at this point, and with fewer sets of eyes to pick up on things like in a school, is there any evidence at this point that it's playing out that way, that kids are actually being sexually assaulted or abused more frequently as a result of being in close quarters without the ability to get out the same way as normal? At this point, is that proving to be the case?
I think, I don't think that we're really necessarily hearing that, but just knowing that violence, really manifests itself in silence. So when people can't talk or reach out, we know that it's going on. It's just that we're not hearing about it. One of the things that we wanted to do was reach out to the schools and let them know that we're available if they do hear of something, or they have some questions, that they can reach out to us, and we could, potentially reach out to families if that, is something that they wanted. We also, I think had something printed up so we could send it in with the packets that were being dropped off, the lunch packets that were being dropped off to kids. So trying to make those connections so that people know that we're there and to reach out if they're able to.
Now, Kris, knowing that helping people navigate difficult court processes and being there to support people, but also the courts are effectively shut down right now. How has that changed the work you guys do right now? Has it meant that can people still go through the process of protecting themselves legally? If so, is it being delayed because the courts are closed? Has the process looked different for those who do go forward? What's it like right now?
The process is definitely different. And the process for after hours orders, emergency hours orders, was changing anyway before COVID. But now, for the most part, it's all done by phone remotely. So people can call the court administrator's office and get hooked up to a court clerk that can help them with the process. Before they had to have their application notarized. Now they don't because there's no place to get it notarized. People are doing this from their home. We can certainly help with that process. Before all this happened, we would meet people at like after hours. We would meet people at the police station or the hospital, and we would help them with those orders, explain them, help them, and answer any questions. Now we're not able to do that, so it's definitely more difficult. I think they feel a little bit more on their own and not sure what to do. And then that's also for during the day, because the courthouses aren't open. They can go in and get the paperwork, and we can help them, get the paperwork. But again, they're filling that out on their own because we're not meeting people face to face. And so the court is still happening in Franklin County. The final relief from abuse hearings are held on Monday mornings, so we do go to court. But we're seeing, I think, pretty steady number of petitions being filed. But what we're seeing is not everybody showing up to court for the final order. And I think that's just indicative of they're not knowing what the process is. Are they supposed to call in? Do they have to appear in person? And I think there's a lot of confusion around that process and how they, can, work through that. So we're just, again, trying to let people know the information.
Yeah, it seems like two factors. It seems like one is that without the easy opportunity to engage more frequently and in different ways, it puts people who aren't well versed in how a process works at a great disadvantage,
right.
Because they don't have the same support structure around them to help them get through these awful and challenging circumstances. The other is, as you're speaking, I'm thinking about, everyone's feeling the stress of isolation right now, but obviously people who are living in fear, it just puts in perspective how much worse it would be if you did not feel safe at home, in addition to having to be stuck at home. I mean, that's, again, the kind of thing we all, I think, most adults understand there are people who have very trying circumstances and who are at risk of violence and things. But, I hope people will reflect on this particular period and how much, more of a pressure point that it creates for these households. Amanda, one of the things I've always appreciated that there are volunteers who step up in the community for organizations like yours. I know that there have been kind of like emergency bed spaces that people would have as a safe place in their home in the past. I don't know if that's still the way it goes. But in light of the challenge of providing services, how have community members been able to help make your work possible? Have they had any role in the last 2 months that's different from the way things normally are?
Yeah, I mean, I think on a couple levels, I mean, with just other community partners, really our community and really the whole Northeast Kingdom has really come together with, NECA, our local CAP agency, has convened, our response teams in both our northern part and our southern part, and really connected, people to resources related to food, shelter, other basic needs. And so it's been, really heartening to see how community partners can really come together to make sure folks are, have what they need. Community volunteers have done all sorts of, creating of masks and things that, we were a recipient of one of those, some of that generosity, and now we can give to our clients, and our staff are able to use those at court and different places that they might have to go. So it's been great. And lastly, I'd say, just really stepping up and with some community donations, with donations of funds for us. There's a lot of uncertainty in our future, like many businesses and nonprofits. And so really stepping up and sharing their stimulus money, or, part of that, or, is really heartening too, to see. We always have great community support, but I can tell people are really stretching and trying to ensure that our services can continue for the long haul, because this isn't just a crisis now. We know that, we're concerned about, of course, right now, but we know that really soon after things open up, we anticipate seeing even more people able to now get help that hadn't been able to. And so the future and support of our programs are really important.
Yeah, Kris, how about the St. Albans area?
I would echo what Amanda has said. We're seeing a lot of people. We have great partnerships. Our emergency shelter response team, we meet every day on Zoom and talk about what's happening out there. Unfortunately, what we're seeing is that, a lot of the homeless population, including folks that are fleeing domestic and sexual violence, for housing in hotels right now, we have run out of hotel rooms. And there are none in our area anymore. So unfortunately, when someone calls our hotline looking for shelter, we have to do some extensive safety planning with them to find some other options. But we're delivering meals to the people in hotel rooms. We have volunteers willing to, step up and do that sort of thing. The masks, exactly. We had a bag, somebody hung a bag of masks on our back door for us, and now we're using some and we're distributing them to others. So really, a lot of people are asking how they can help, and the outpouring has been wonderful.
Well, that's great, and I hope that people think about helping you after we're through COVID-19 as well. Maybe one of the silver linings, if there is one, about all this is the feeling of connectedness that people are, I think people who are in the helping business maybe feel that way all the time, but for people who are grateful for that but go about a different life, I think maybe more appreciation for what happens if you don't have supports in place for times like this to help people who are particularly vulnerable. So I think we've got time for one more question. I'll ask you both. We're 2 months in. I still remember the day the State House closed. It was ominous, Friday the 13th of March. So in about a week, it'll be a full 2 months. And we're not out of it yet. And the stay-at-home order is likely to be extended, and there'll be a slow easing back into some normal activities over the course of the late spring and early summer. But where we're at now, anything, maybe Kris, ask you to start, anything when you look back already at this stage, you think, wow, that was a moment where somebody who works with us really stepped up, did something that just kind of stood out from what would just normally be expected?
Well, I just have to give kudos to my whole staff. They have really stepped up and really have pivoted the way that they do this work. And, from getting emails from survivors in the middle of the night and getting up and answering those emails, when that's not something that we did prior to, because our after hours on call people would take care of that. But they're just stepping up to the situation and really looking, to help people in whatever way they can. And I do want to, one of my staff, we had trouble finding phones for survivors, because we do that anyway. We provide cell phones to survivors that their phones are taken away or ruined or what have you, and we couldn't find any phones anywhere. And she managed to get some phones from a store, because they're not considered essential goods, and really called the Attorney General's office and went to the high levels of the state to try to get these phones. So she went above and beyond what I would expect anybody to do. So I just give kudos to my staff. And I think this core group that we have established that meets daily in our community, everybody is just going above and beyond and helping each other through
Well,
this.
that's great flexibility on the fly, it sounds like. So thank
Exactly.
them. Amanda, how about at Umbrella?
Yeah, I would share too, in terms of just my pride in the team that has stepped up to, not only work from home and, deal with rising kind of crises happening with survivors, but also doing so when they're, at home parenting a couple kids or,
Right.
Educating them. So like many of us, that's kind of what's going on. I think the folks that, have to continue to go, can't just telework, that do have to go and be in public, to go to court, to go to hospitals, to go to shelter spaces frequently, they're putting themselves at a certain risk, and, they're taking precautions, and we've, given them some appreciation pay for that work, but it's still something that I think really is going above and beyond, really being there for folks. No matter what. And I think that the thing that really sticks out to me, I guess, is within, this whole scenario, you would think it'd be really hard to kind of continue some of the progress that folks have been able to make, some survivors. And even though we're in the middle of a pandemic, our staff have worked really closely with some survivors and moved 2 or 3 into transitional housing. So they've been able to get into a location that they can stay in for up to 2 years and be on their road to, their kind of their safe life and on to a healthy life for their family. And so despite all of that, we're able to support survivors and create and continuing to progress on their journeys. So that's something that I think, I feel proud of, that they can do that.
Well, both
Exactly.
of you, I think, should be really proud of the crews that you work with. I think that, as those of us who do not do the work you do, first off, I think have to, really have in mind the people you serve, who are as vulnerable or more so than ever while we're in a stay-at-home order. And people have to, I think, understand that we need to provide the resources to support people who are facing that crisis, because the type of violence and threats of violence that you encounter in your work could happen to anybody. And for that reason, it's something that when it's not immediately facing your friends or family, it's easy to take for granted that it's somebody else's problem, but that could change in an instance. And so it's so important that you're there doing it. And it sounds like your teams have been pretty admirably adjusting to this new way of delivering services. And I know it's not easy. The Senate is a very traditional institution, and we've been forced to change our work overnight, we had growing pains. And I'm sure that there were some transition issues, but it sounds like you're still providing really amazing support. So Kris Lukens at Voices Against Violence in the St. Albans area, and Amanda Cochrane at Umbrella in the Northeast Kingdom. Thank you guys so much. And for all the people watching, tomorrow at 5:30, I'll be joined by 2 frontline staff at the Howard Center talking about how their work and the service that they provide to clients with mental health challenges in Northwestern Vermont have been impacted by COVID-19, and really hope you'll join me for that. And then, of course, continue to believe the best thing we can do to start returning to normal lives is to continue to follow all of the orders that we're hearing from our Department of Health and the Health Commissioner, because the sooner we snuff out this virus, the sooner we can get back to the way things were before. So thanks and good night, and I'll see you tomorrow.
Thank you, Tim.
Good night. Thanks.
Bye.